Welcome, Luna family. My name is Dr. Effie Flourentzou. I am a GP and a medical aesthetics doctor. I am the founder of Epitomi Aesthetics. So welcome. Today we will be answering 10 common skincare questions that come up very frequently across the board. I focus a lot on regenerative treatments such as sculpture, polynucleotides, exosomes, microneedling. But I also obviously still do a lot of neurotoxin treatments and dermal fillers. So skin cycling isn't actually a new concept when it comes to skincare. Many dermatologists, even I use it when we are introducing patients with active ingredients such as retinoids and exfoliants. And it's done to reduce the skin irritation and allow the skin tolerance to build up. So it's not completely new, but what's happening lately with TikTok is they are oversimplifying the skin cycling and this then makes people think that actually, yep, this is simple to do at home. I can just use some products one day, some products the other day, but you need consistency with these active products and you need professional guidance. Yes, skin cycling isn't new, but how to use it to get the best results for your specific skin needs, that's where you need the professional advice with the right ingredients and strength to help you and support you through this journey rather than just following a one-fits-all program from TikTok. You need to understand what Botox, like the botulinum toxin, does. It temporarily relaxes the muscle that will cause certain wrinkles when you're doing certain movements. Now, if you're in your early 20s and you don't have those wrinkles, then you don't need Botox. You don't need to have a treatment with a neurotoxin. And that's the same with baby Botox, is essentially the same treatment, just with smaller doses, which means your results are going to last for a lot less, and then you're going to need it again. If you don't have those static lines that have formed from repetitive muscle movement, then you don't really need neurotoxin treatments. So in your early 20s or even early 30s, if you don't have those static lines, and I would mostly recommend thinking of your skin quality. So think of regenerative treatments. Keep your SPF 50 every day, even in the winter. That's your insurance for your skin for the future. And then focus more on ingredients such as an antioxidant, your retinoid, depending on your age and your needs. But don't go for Botox if you do not medically need that treatment. There's an important distinction. There's a distinction between preventative and then being proactive. Preventative skincare, such as you're being consistent with SPF on a daily basis, have incorporating an antioxidant into your routine. And then again, depending on your age, maybe incorporating a gentle retinoid. These are all going to support your barrier and will be beneficial in the long term in terms of producing collagen and just protecting your skin. You can class this as preventative, but you're not using any harsh ingredients, you're not doing any harsh injectable treatments or peels you may not need the younger you are. Overusing these active treatments or peels or injectables when they're not actually needed can actually cause more harm than good for you, and especially in impairing your skin barrier. So at Epitomi Aesthetics, I always advocate to be proactive with your skincare routine and your treatments and make an informed approach. When it comes to barrier health, the most common mistakes I see people do are over-exfoliating or combining too many actives such as your alpha, your beta hydroxy acids, and retinoids together. Another common mistake is using harsh cleansers because they've heard this double cleansing tip and they mistake it for meaning using too many products. And what this ends up doing is just stripping the natural oils of your skin, which impairs your skin barrier instead of improving it. Neglecting your SPF on a daily basis is the most common mistake I see people make. because they neglect the fact that you need to protect your skin even in the winter, even when it's cloudy, even when it's rainy, so much more against the UVA rays, which is your aging rays, rather than just thinking your SPF is to protect you from burning, which is your UVB rays. Another common mistake is people not moisturizing enough, especially my patients with acne, who they tend to have oily skin. So they assume that because of oily skin, you shouldn't moisturize. That's a complete myth that needs to be debunked. Your barrier essentially is impaired, and we need to protect and repair that barrier with the right type of moisturizer, with lots of humectants to maintain and keep that moisture in. And finally, people don't give their skincare ingredients time to do what they need to do. That it's not a race, it's a marathon, it's not a sprint when we're looking to make changes to your skin. So if you're looking to make a change and improvement in 2, 3, 4 weeks, then that's not going to happen. So chopping and changing your products because you haven't seen a quick enough result is definitely one of the top 3 mistakes people make. You need to give your skincare enough time. The Korean glass skin is everywhere at the moment. You only need to just swipe your phone on and you're seeing lots of glass skin masks or skincare routines advice. Everyone wants to have that luminous, hydrated, glowing skin. And that's universal across every country in the world. And most of the Korean skincare is very good and it's regulated in Korea. And that's the main point. So what works very well and regulated for Korean skin doesn't always translate well in the UK because we have different climates, our skin type is different. So just because it works very well in Korea doesn't necessarily mean it will work as well for you and your specific skin type. So we have colder, drier weather, and our skin reacts differently to layer in lots of different types of active ingredients. Just because they claim to be hydrating and non-occlusive doesn't necessarily mean it will be the same for your specific type of skin. I will always advise, stop chasing trends. That's, I think, the key point here. See a professional if you've got true skin concerns, and we can then advise you based on your specific skin type and the health of your skin barrier to give you a more balanced routine to use. So the aim isn't to follow trends and have that super glassy skin. Your aim should be to have a healthy, balanced and calm and glowing skin in your own way. I don't recommend DIY microneedling or dermaplaning. Professional treatments are done in sterile conditions with clinically validated depths and trained techniques. So at home, there is this false sense of security because it's an at-home treatment, but then you don't foresee and you neglect the risks, which are infection, high risk of infection, pigmentation can get worse, you're actually damaging your skin barrier instead of improving it, which is the whole aim of these kind of treatments. I've seen many patients who have done microneedling at home where they've ended up with lots of horizontal scarring because what they have done is they haven't obviously clearly been trained in it, and instead of gliding the pen over the skin, they drag it, and now they've left with scarring. They've done this unknowingly and unwillingly. And also, if you suffer with acne, you really need to have these kind of conditions in clinic sterile situations, because even us as practitioners, when you have active acne, we wouldn't microneedle. So definitely do not recommend these treatments for at-home use. Think of your skin as your first line of defense. You need to look after it and not follow trends and do things that can damage it. So instead of having these DIY microneedling pens or devices at home, what I recommend to my patients is as a maintenance, and not as a replacement to clinic treatments, because the results won't be the same, but as to maintain your results after microneedling at home or various skin treatments is I recommend the Luna Microcare patches, where you can use them either under the eyes or if you've got static lines like I do on your forehead, or to soften these nasolabial folds. So these patches have microneedle patches with selected active ingredients that what you do is you just press them onto the skin, and then the microneedle patches dissolve, and then the active ingredients go into your skin. So this isn't to replace clinic treatments, but it's to help you maintain your results at home. Skin flooding is what we refer to when you're applying different layers of hydrating products to damp skin. And this can be effective when done correctly. So using humectants like hyaluronic acid, followed then by occlusives or an emollient, which is then going to lock in that moisture, is great. But more isn't always better. So if you're not supporting your skin by using the right humectants and occlusives, then all that hydration or all the different products that you've basically applied on your skin is just going to evaporate. So all that flooding is going to do nothing to your skin. So it's not a gimmick, but it needs good formulation and science behind it. You're using the right ingredients in the right order, you get that added effect and benefits of the hydration. And just remember, not all mists or serums are created equally. I personally love tretinoin or any type of retinoid, but it needs to be used in the right person at the right stage of their life. You see a lot of skincare brands now marketing to teenagers, youth, adolescents, and they're quite heavy on retinoids. And this is the part that I disagree with. In my patients that I see at Epitomi Aesthetics, usually 30 and over, your retinoid is going to be like your staple all over anti-aging product that I would recommend to incorporate into your skincare. However, that's because by that stage, your skin will have some signs of aging, and it could just be fine lines and wrinkles. It could be pigmentation. It could be like the texture of your skin has changed. And that's where the retinoid or retinol is indicated. Whereas if you compare that to your teenage skin and your adolescent skin, where it's so much more sensitive, so much more vulnerable to all these different active ingredients, unless you are seeing a GP or a dermatologist because of acne, then you shouldn't really be, I don't recommend you starting a retinoid at that age, if you don't have acne. So at that age, all I would recommend is a gentle SPF, a gentle cleanser. Focus on incorporating and getting used to wearing your SPF on a daily basis. And that's and a moisturizing cream. That's all you need as a teenager and a young adult with no specific skin concerns. When you're talking now about incorporating a tretinoin or a retinol, then again, you should do that with guidance from a professional. The higher up the ladder, the higher up the retinoid ladder you go, so tretinoin being your highest, strongest ingredient, you will need to do it slow and steady. Your skin will need to get used to it. There may be some irritation to begin with. Your skin may feel dry, might be flaky, and you would almost certainly experience some purging, which means over the next 2 to 4 weeks when you start, you will notice more spots. And that's all because the retinoid is increasing your cell turnover. So it's doing what we want it to do. But if all of this hasn't been explained to you because you've just bought something off the counter because you've seen it on TikTok or social media that it's great for your skin, if you don't know what to expect, then you will stop using it and think it's not helpful. You may be using it at the wrong phase of your life. It can be with like my younger patients because they see this clean girl aesthetic that all over everywhere and it seems effortless and that's what they would like for their skin. But what people don't realize in most cases is you need to think of the lighting, where those photos were taken. You need to think of what treatments has this person had, their genetics, and are they using any filters? So it's not a very simple, easy thing to achieve in some people. So my patients who have acne, for instance, or rosacea or blemishes, It's not going to be a one product or one treatment that's going to get you that glowy, smooth skin. It's going to be a combination of things, skincare products with active ingredients that we know are going to do what we want them to do and get you the results you want, plus added clinic treatments. I focus on healthy skin, not perfect skin. We can redefine what normal skin is, what normal skin looks like. Absolutely, it's necessary. 90% of skin aging is from UV exposure. And it's not so much just the UVB rays, which everyone obviously associates with burning of the skin and skin cancers, but it's also the UVA, which is the aging rays. They penetrate through clouds, they penetrate through glass. So you could be you can have a job where you drive all day, so you think you don't need UV SPF protection. You definitely do. So it's all about the UV levels and not just the UVB rays. UVA is the same all year round in the UK, whether it's raining outside or it's cloudy or we're going through a rare heat wave in the UK, the UVA rays are the same throughout the year. So your daily SPF is your one easy product that you can use on your skin to protect it long term. There is absolutely no point in destroying the results that you get with your other skincare products or even skin clinic treatments if you're not doing the most basic of skin protection, and that's using your SPF on a daily basis and reapply every 2-3 hours, especially when it's quite hot outside. There are lots of studies that have shown twins, like twin sisters, where the one twin sister using her SPF daily for years and years, doesn't smoke, doesn't drink any alcohol, and then the other twin sister doesn't use SPF, smokes and drinks alcohol on a regular basis. And you can see when they're in their 50s, the stark difference in their skin. Yes, has blemishes and it has clearly aged naturally, as you would, but then the twin sister who hasn't used SPF, was smoking, drinking alcohol on a daily basis or a regular basis, her skin is leathery, it's got lots of pigmentation everywhere, it has increased her risk of skin cancer, and you can see the stark difference. So if you do one thing and one thing only to protect your skin long term, you start using your SPF, make sure it's tinted, broad spectrum, ideally SPF 50, and just use it daily, whether come rain or shine.